Hi everyone, and welcome to your At the Bedside Case of the Week. It's going to be a little different this week because our patient isn't actually in the ER with us. So you're sitting there with your attending, and you hear a report called in by EMS. This is an 82-year-old female. They were called to a nursing home to evaluate. She's got a history of AFIB. She recently had a pacemaker placed, heart failure, aortic stenosis, diabetes, and COPD. She presented with an episode of chest pain, diaphoresis, and pallor. They arrived to the scene. She had no pulses. They did 2 rounds of CPR and got ROSC. She has an LMA in place for an airway. They did a 12 lead and it's being transmitted. ETA 10 minutes. Her vital signs after CPR: she had a blood pressure of 95/70. She's a little bit tachycardic with a heart rate of 105. She's being bagged with her LMA satting 95% and a temp of 37 Celsius. We're going on. Ask yourself these questions. What are the EKG findings for a normal left bundle branch block? And what are the criteria used to evaluate a left bundle branch block for a STEMI? So, before we get into left bundle branch blocks, let's start talking about normal cardiac conduction. Depolarization starts in the SA node, senoatrial node in the right atrium, and then travels to the AV node. And then from the AV node, it goes down the bundle of His, which then splits into 2 bundles, the right bundle and the left bundle. It travels simultaneously down the right and the left bundle to the Purkinje fibers, and then spreads along the Purkinje fibers where it ends up depolarizing the right and left ventricle. A left bundle branch block is exactly what it sounds like. The left bundle is blocked. So the depolarization travels down the right bundle from the bundle of His first, and then slowly makes its way across the septum. So the depolarization of the left ventricle is actually delayed. So there are EKG findings because of this. Number 1, because the overall conduction time to the left ventricle is delayed, you actually get a wide QRS, more than 3 small boxes, more than 120 milliseconds. Number 2, because the final depolarization is moving away from the right ventricle and V1 looks at the right side of the heart, you get a dominant S wave in V1. And finally, because the final depolarization is moving toward the lateral wall of the left ventricle, you get broad R waves in the lateral leads, as you can see here. So how do you evaluate left bundle branch block EKGs for STEMIs? Well, there are specific criteria, and this is called the Sgarbossa criteria. It's actually called the modified Sgarbossa criteria because it was modified at some point. It's also really, really important to note that these criteria can be applied to ventricularly paced rhythms. And as you can see, in our patient's EKG, she is paced. These are pacer spikes right here. So remember, you use Sgarbossa criteria both for left bundle branch blocks and ventricularly paced rhythms, such as our patient's EKG. In light of this, let's see if our patient's EKG meets criteria for a STEMI. So first, Sgarbossa A. Does she have concordant ST elevation in any lead more than 1 millimeter? Well, take a look here at lead V2. You can see the QRS is pointing up, and she definitely has 1 millimeter of ST elevation there. So she actually meets that criteria. Now, let's take a look at Sgarbossa B. Concordant ST depression more than or equal to 1 millimeter in V1 through V3. Well, she doesn't have ST depressions in V1 through V3, so we do not meet that criteria. And let's take a look at Sgarbossa C. Excessively discordant ST elevation, more than 25% of the QRS in V1 through V4. Take a look at this lead here. You can see our QRS is going down, and you can see that our J point is right here. And that is a lot of ST elevation. That has got to be more than 25%. So we can see that it actually meets this criteria. It's important to note, however, that you only have to meet one of these criteria for your left bundle or ventricularly paced EKG to meet the Sgarbossa criteria. So this is clearly a STEMI. Oh, now you're sitting there with your attending. You've evaluated the EKG as we have just done. What's your plan? What are you going to do? Well, what do you have here? You've got a STEMI that's actually arriving in about 8 minutes. So call the cath lab and prepare for post-STEMI management. You have a very sick patient coming in. Make sure that your interventional cardiologist is aware and ready to take them. The takeaways for this week were to be able to recognize the typical findings of left bundle branch block on EKG and to evaluate left bundle branch block EKGs for modified Scarbo's criteria and call the cath lab if they meet criteria. See you next week.